and Callie here. Here from the Department of Health, and they're going to be talking to us about Project Firstline, which is a partnership between the CDC and the Minneapolis Department of Health that aims to provide engaging and effective infection prevention and control training to frontline workers, staff, and members of the public health workforce. Their learning objectives are to recognize the role that all frontline healthcare workers have in preventing the spread of germs, to increase awareness of the MDH Project Firstline initiative, and to identify and access MDH trainings and resources for Project Firstline. And everybody on the call will be receiving a CEU if they complete their email, kind of the email requirements that Kathy sends out after this presentation. So I think if the three of you wouldn't mind just introducing yourselves and your role before we get started, that would be great. And I'll put myself on mute. We look forward to this. Thank you for joining us. We know it's a big effort that you all put into preparing, and we appreciate it.
All right, well, great. Thank you. I'm actually got double audio going on here. So, all right, perfect. Thanks for the introduction. You did a lot of the work for us already, so I appreciate that. I'll just put my camera on just for a quick second so you guys can put a face to a name. Hello, everyone. I will introduce myself, and then I will pass it over to my other teammates. My name is Kara May Steinwan. I come to you with 13 years of infection prevention and control experience. Previously, in my previous role, I was a pediatric infection prevention and control specialist from a freestanding nonprofit pediatric hospital in Minnesota, and then just transitioned just 2 years ago to Minnesota Department of Health. And I have two roles there with Minnesota Department of Health. I am with the ICAR team, which is the Infection Control Assessment and Response team. And then I also am your MDH CDC Project Firstline team lead. So I have a diverse and just a brilliant team to work with on a daily basis as well. And so I'm very, very lucky and very blessed to be able to have that. So any questions you have for me, please let me know, but I'm gonna hand it over to Pam for introductions for Pam.
Thanks, Kara May. It's good to see you, and especially good to hear you. Hello, everybody. Thanks for coming. Well, actually, you didn't even come to us. We came to you tonight. We usually have people coming to us, so it's nice to be here. My name is Pam Arnold, and I am a registered nurse on the ICAR team, again, the Assessment Control Assessment Response team. And I'm also a program planner with the Project Firstline team. And I actually came to MDH in 2020 through the CDC COVID Care Corps. So that was the core that was developed as a result of the pandemic and the needs that the state jurisdictions had. And I was deployed out to the Minnesota Department of Health. I thought I would do my duty and be there for a year. And here I am still there with the Minnesota Department of Health, and happy to be there because this Project Firstline initiative is really a frontline healthcare worker driven initiative. And so I'm excited to be part of that. And I can pass that over to our colleague, Callie Floyd. Thank you.
Hello, good evening, everyone. My name is Callie. I am a health educator here at Minnesota Department of Health. Like Kara May and many others, I do wear a couple of hats. I work with the HAI-AR, or Healthcare Associated Infections and Antimicrobial Resistance Unit, the Programs and Partnerships Unit there. And I'm here today, of course, with Project Firstline. Like Pam, I did start my career with MDH, also working on COVID. Spent a lot of time in case investigation and then in our guidance unit. And yeah, very excited to have everybody learn a little bit more about Project Firstline and some of the resources that are available. So I'll hand me back to you, Pam or Kara May.
Great, thanks. So you got just to meet a couple of our teammates. We do have an expansion of our team, which we'll get into during our presentation as well. So I will bring it back to Mary to kind of just guide us in the next steps and just tap us in when you're ready for us.
Kathy or Heidi, did you have anything else you wanted to say?
I'm sorry. Before? No, go ahead and display your presentation. If you have any hiccups, just let us know.
All right.
I think we're seeing it. Great. Thank you.
Great. Thank you.
Fantastic.
It
I'm going to turn my
looks good.
camera off here so we can focus on the slides. Carrie, did you want to say anything else before we got started?
I'm pretty excited. So I'm jazzed up. We're ready to go.
Okay, great. Okay, so let's get started. We're going to introduce you to the Project Firstline initiative. And one of the things that we did to sort of be creative about our work with Project Firstline is create what we call a table talk with MDH Project Firstline. And you can hear a little bit more about that later when we get into more specifics about training. But it's really a space that is sort of an informal space where we can talk about formal and very important topics. So we want everyone to be comfortable. We want you to be able to ask questions if you have them. Feel free to. This is however Kathy runs this. If you speak or raise your hand or put it in the chat, whatever you do there, just feel free to engage and to communicate with us as we move through. We can go ahead to the next slide, Callie. Great. So here's our agenda for today. You've already met the team, so we've got that checked off. We're going to introduce you to our website and how to keep up with all the work that we're doing. Yes, go ahead. Oh, thought I heard somebody. Okay. And then we're going to move through some training details with you. You might even get a little sampling of what it's like to be in a Project Firstline training. And then we'll talk to you about our resources. And then we'll close up with our conclusion and questions and answers and how we can maybe partner together with your organization and others. We can go to the next slide. And as Heidi already mentioned, we do have 3 learning objectives for today's session. And just as a quick review, once again, we want to increase your awareness of the Department of Health's Project Firstline initiative, what we call PFL. We also want to recognize the role that all frontline healthcare workers have in preventing the spread of germs, and to be able to identify and know how to access the MDH Project Firstline or PFL trainings and resources. Next slide, please. And again, Heidi did already touch on this, so I'm just going to quickly go through this because the verbiage here actually is really good and really accurate about what Project Firstline is. So this is a partnership between the Centers for Disease Control and the state and tribal jurisdictions, of which MDH is one. It is a collaborative made up of diverse healthcare and public health partners like the American Academy of Physicians, like American Pediatric Association, hospitals, jurisdictions, as I just mentioned. And the whole aim is to provide engaging and effective infection prevention and control training to frontline healthcare workers, staff, and members of the public health workforce. And what's really special about Project Firstline trainings is that they are created to be innovative and designed such that regardless of the role, previous training, or educational background, that staff attendee at the training will understand and confidently apply the infection control principles and protocols necessary to protect themselves, their facility, their family, and their community from infectious disease threats. So that's really the key part. Regardless of role, number of letters after your name, any previous training, we want to get the fundamentals to you as a frontline healthcare worker. We can go to the next slide. So as Kara May mentioned, we do have a bigger team than the 3 of us. You've got the first 2 here with you, Kara May and Pamela, and then Callie down there second from the bottom. But we also have another RN that works with us, helping us to create contact, an epidemiologist, and a communications specialist. Go ahead, Callie. Okay, so let's get to the first section of our slide deck tonight, which is about our trainings and our resources. Next slide, please. So hopefully you can see this. The font looks a little bit tiny, but basically we want you to see the actual website, not just give you a link to get there. So you can see that we've broken it up into describing what Project Firstline is and then the training and resources section. And we're going to show you a little bit more detail there, but we want you to know that you've got this QR code right here and you can actually access it right now with your handheld device if you'd like, but that'll take you right to that spot there, which is the subscription space. And if you put your email in there and hit submit, you're now subscribed to Project Firstline and you will be first in the know when we have any new information to share, like new resources or new training dates or anything new like that, you will automatically get that information into your inbox. So if you like what you see today, we sure hope that you'll go over there and you will submit and subscribe to MDH's Project Firstline program. And it looks like Callie is getting ready to put that information in the chat for you as well, so that you can easily get to our Project Firstline website. Next slide, please. So as part of our website, we have the training and resources part of the website. And you can see on the left side, there's just a screenshot there. We record all of our live training sessions and we post them up on our website. And we've divided them out by content. So you can see we have a training on that's particular to the home care setting. We have interactive resources, and we'll share more about that later. We have COVID specific trainings up there, trainings on risk and reservoir, because it's always good to know where germs live and grow so that you know how to prevent them spreading. But we've already got we've already got 28 total trainings that are up on the website. And again, on the website means you have 24-hour access to them. And the other beauty about our trainings is they are 30 minutes or less. We've even done 15-minute and 20-minute trainings, which is great for the staff that are on the floor. And again, these trainings benefit those that interact with patients, residents, and/or clients and their environment. So you can see these trainings would be appropriate for your nurses, your CNAs, your environmental staff, your dietary staff, your administrators, everybody who comes in contact with patients and the environment. Those are the people that can benefit from our trainings. And we have English as well as Spanish resources too. And something that's really new for us, just as you're earning a CEU tonight, we have proof of attendance now for anyone that attends both our live and recorded sessions. So you just take that proof of attendance and then you can go to your board of credentialing and determine if that will fit for you for CEUs for your license renewals. Go ahead to the next slide, Callie. Thanks. So this just took us deeper into another level. Again, we want you to see a little bit more of the website so that you're just not going to the link blindly. We wanted to give you a little bit of a taste of it here. So I showed you the first page, which had the different content sections. If you go into that content, this is the interactive infection prevention and control section. You can see, for example, that when we post a training, we post the actual recording of the live training. You can see that was Diarrhea Dilemma was recorded on March 7th. It's 39 minutes long. In addition to that, you get the PowerPoint itself for use if you're going to do some training in your facility. You also get the PowerPoint in Spanish. And then the final bullet is you get the CDC Diarrhea Dilemma interactive resource that you can access or have your associates access on any handheld device. So for each training that we post, there's multiple sort of platforms and ways you can use that information when we post it as well. Next slide, please. And we wanted to share with you some of the participant feedback that we've gotten. And remember, we've already done 24 trainings and we've had, oh my goodness, I should have had this number at my fingertips. Maybe my colleagues know it. I'm trying to think of how many people we've trained so far. Oh goodness, it's definitely somewhere in the thousands, but these are some of the things that people say that attend our training. It's easy to understand and relate. I'm new to the role of infection control. This is really helpful. I'd love to use this exercise with my staff. The key points have been helpful in reminding me where the start of infection control is, because we get lost in the constant COVID protocol changes. It's nice to go back to the basics. And this other participant says, we use this program for monthly education. Thank you all for the extra legwork you do for us. It's very much appreciated. Go ahead to the next slide, please. So in addition to our recorded trainings, and live trainings, we have interactive and printable resources. And this is just some to give you an idea. So for example, there's a one-page job aid called Germs Live on the Skin. That's something that you could post That's something that you could teach from. We also have this wonderful how to read a label on a disinfectant. Super important, of course, especially as we deal with MDROs, which are, oh my goodness, rising every year here. So this detailed job aid gives you all the specifics of what you need to know and how to read a disinfectant label. We also have the interactive trainings. And by interactive, I mean that you actually have to do something that changes the screen. So you have to take an action, and we'll show you a little bit how that works later. But we have several of those posted on our website as well. You can go to the next slide, Callie. Oh my goodness. And one of our newest resources, our hand hygiene handout. And this gives you the 11 steps that are needed so that you can feel confident you have fully and completely washed your hands before you don your PPE or after you doff your PPE. And again, this is a wonderful handout that you could put around your sinks, in your break rooms. This is also posted on our website, or will be. Karen may have to correct me on that. We can go to the next slide. Again, our interactive trainings, which we keep talking to you about, these are recently new that we put up on the website. We did a training specifically for home health staff and nurses, and we delivered that as a live training. We also delivered that at the Minnesota Home Care Association conference, and we will do that again. We've got a mini series, which is I Spy with My Infection Control Eyes. Those were like 15 to 20-minute trainings, which attendees said they love to be able to get in and out of that training and get some really great infection prevention and control knowledge. And then our other interactive training, Where Germs Live and How They Spread, where you get to identify the reservoirs and how the germs spread from that reservoir. Again, a very interactive, engaging training. Next slide, please. And now what we're going to do is we're going to do one of our interactive training demos for you. The purpose of this is really for you just to get a feel for what an interactive training is like. It is not a full training. It's just to give you a feel. And I'll turn that over to Karen May. Thank you.
Great. Thanks, Pam. Can you guys still hear me okay? Does everything sound good? Okay.
We can.
Well, I am so excited. So just to kind of go back to the hand hygiene PDF, we do have that available and posted on our website. And I have been dubbed the hand hygiene queen from my previous role. I absolutely love hand hygiene. I don't know if you can find anybody else out there in the current infection prevention control program that is most obsessed about the hand hygiene. So I will share with you that if you have any questions about hand hygiene, you want to know how to get a hand hygiene program off and running, you want to know more about an auditing program, with the ICAR team, we just got back from APIC National. And so I don't know if some of you have the opportunity to be there, but we did our presentation with our audit tools from the MDH ICAR team. And so I was content expert on 2 of those, hand hygiene, of course. I know you're probably surprised from what I just shared with you. But also, I also did the PPE. We have one that is about wound care, and then we also have another auditing tool around environmental cleaning. So just another plug for an opportunity to be able to kind of look at Project Firstline, but then if you need additional levels, we have that available at Minnesota Department of Health for you as well. So Pam alluded, we have the interactive training demo, Understanding Where Germs Live and How They Spread. So we're going to give you a little bit of insight, but then you know what? We're going to take it a step further a little bit later in about 4 or 5 slides and actually see how you do about conducting a training with us. All right, so let's go to the next slide, please. Uh-oh. Are we good? Okay, we're good. All right, so you'll see this as a familiarity. We did show this little snippet of picture in a couple of our other slides. This actually walks you through the entire system of reservoirs. So we're talking about the 4 main healthcare environment reservoirs and the 4 main body reservoirs. And so I don't know, are there any of you that are involved in any type of that forward-thinking infection prevention and control, or part of an infection prevention and control program, or maybe quality and safety program, go ahead and put that in the chat, like, yes, I am. And so we'll monitor that chat function as well. But what we're going to do is we're going to actually just take a moment and walk through a little bit of what our team put together, but then also how that demo went, or that training went through this demo. So let's pick the very first purple dot here. And what we did through this piece of it is we selected the purple dot. We worked from the left all the way to the right. And we had Slido come pop up, which you're going to get a little bit of an insight of what Slido is if you haven't had an opportunity to explore that. But we selected this circle, and it was up to our attendees to go ahead and name that reservoir. So it kind of felt like a Jeopardy, a little bit like, oh, I'll take quality and safety for 500, please. But really, we had Slido, we had a multi-select, and we just let people decide, what do they think that reservoir is that we're trying to get at? So this selection was about water and what surfaces in the reservoirs of the germs. We had another click through that really explained and went through that process. And again, we're building that foundational knowledge to be able to get them to a better center. And sometimes this is based on brand new staff that's coming in. Sometimes we really need to drive home, like, hey, we've got some water and wet reservoirs that need to be, looking through. And so Kelly, you can go ahead and click to that next piece there. And so we had that opportunity. So like, let's say you have Pseudomonas aeruginosa. Maybe that's happening and you want to refresh about the water and wet surfaces. What does that look like? Okay, so we're talking about the puddle on the countertop. We're talking about most of the time the tap water does not impact healthy people, but could definitely cause illness and very weak immune systems. We're talking about medical instruments and equipment. If they get wet, what happens? Well, when you have a wet surface, you start to create an environment for what to grow, bacteria to grow. So we think about what in that white box, you're probably like, well, that seems incomplete. We gave another Slido opportunity for people to select what they think the best infection prevention control action would be based on the reservoir we're talking through. So go ahead and click that. And Callie will reveal that. So here's the infection control actions based on the water and wet surface reservoir. So we talked about cleaning and disinfecting. We talked about device sterilization, hand hygiene, and use of PPE. All right, let's go ahead and select another one. We're going to go back to that main picture. And let's go ahead and select the one that's near the ladder. And this one is about dust and dirt reservoirs. Anybody involved in ICRAs here? Anybody know what an ICRA is? Go ahead and either come off mute and say, yes, I have, or put it in the chat. Anybody involved in the ICRA situation? Anybody know what I'm talking about when I say ICRA? Okay. All right, so it's an infection control assessment in risk form, and it kind of just breaks down and works through like, okay, if there is, let's say a pipe burst, there's a lot of things that go into that, and that includes your ICRA with your infection prevention and control team. So let's go ahead and select that and let that pop up. So they identified that this is going to be a dirt and dust reservoir for germs. Walks us through a little bit more. Go ahead and select through that again, Callie. We talk about what type of things or germs live in the dirt and soil. So why do we need to be concerned about that when we have that in our settings, in our hospital settings? Again, a vast majority of this is not problematic for healthy people, but can cause serious illness in those who have compromised immune systems. So thinking about that building construction, or if some of us have been involved in a setting where around us might have had a wildfire, or they might have had a fire across the street from a building. That is going to impact your ventilation. That is going to bring in soot and dirt and dust into your ventilation system. So more things to think about. There's more germs and other considerations to think about as well. So there are smaller construction and maintenance projects. You'll think of, maybe it's not that big of a deal, but there are things that get aerosolized when construction occurs. So even if you're removing ceiling tiles, I don't know if some of us in our expertise here have dealt with that. Like you'll see wet rings on the ceiling tiles, or if you know that they're wet, they're a little soggy, or just the particles that fall from that. That has lots of great things that are growing in that. So we want to progress into that. Again, we gave in the Slido opportunity for our audience, we gave them, okay, now that you know about dirt and dust reservoirs, what are those IPC actions that we would think about? So let's go ahead and reveal that, Callie. All right, so cleaning and disinfecting, we talked about the ventilation, using barriers. If you're doing types of construction, whether you might think that's very small or minimal, it could be a pretty big deal for those patients, residents or clients that you're taking care of. And of course, I cannot move without any of these reservoirs without talking about hand hygiene. Of course, That is going to be my number one. That should be my number one checkbox, but it's the last one here on this one. Okay, let's continue to move through this picture. So we just kind of selected 3 of them for you to just kind of understand the process in which we go through. So let's go ahead and select that last one. Again, we did all of the purple dots and they turned colors once we were done. You'll see that it goes from a red circle to a green circle. So let's go ahead and select this one. What is this reservoir? This one happens to be about medical devices for germs. So let's go ahead and also reveal the conversation we had with our attendees about medical devices. And we know that medical devices outside of healthcare workers, pathways being touch, transmitting infection and diseases, we also know that devices do that same thing. So we're thinking about that pulse oximeter. This is used on the patient's body to provide care, but the germs can be on this device. And then of course, spreading it to our patient, our resident or client, and then it gets that entrance into the body. It just needs a little bit of opportunity. So when we think about that device and we put it on that patient's body, or we're thinking about IV needle insertion or endoscopic procedures, maybe it's surgery like artificial hips, we want to make sure that we're taking a look at those and then thinking about those devices. If they're not already patient dedicated, what is the cleaning and disinfecting process that goes with that? Which I kind of just revealed what's in that white box. Let's go ahead and reveal what's in that white box. Okay, so cleaning, disinfection, device sterilization, hand hygiene, and use of PPE. In this instance, we'd be thinking more about the gloves because we're thinking about the touch and the handling of things as well. So we can go on to the next slide. So hopefully we've intrigued you a little bit as far as how some of our trainings go, specifically our interactive sessions. Let's go ahead and go to the next slide, please, Callie. And again, we went through all of those purple dots. So lots of reservoirs to talk about when we talk about the healthcare and when we talk about the body. I'm going to pause just for a second. Does anybody have any questions? We're about halfway through, so I just wanted to make sure that I'm pausing enough to give you all some time to ask questions, or if you're intrigued about something, or if you want more information on something. Maybe you all have a question about hand hygiene because that's my favorite topic. Okay. All right. Well, we're going to move on. Oh, go ahead.
This is Heidi's voice. I think it's really great that you've made it interactive and that you have pictures like that. I think a lot of education, historically has been in written format. But I think making it interactive in the way that you did is really going to make it more memorable for people. At least
great. Yeah, good feedback. Yes. And, sometimes I am that visual person. Sometimes I have to think about things, but then I also need to read it. And so part of what Project Firstline tries to do is that multi-level and meeting the, attendee where they're at. So are they entry level? Are they advanced learning? We try to use the language that supports both. But, also taking a look at the different types of adult learning styles as well. It's not a one size fits all for sure. And when we're thinking about building those basics, we want to be extremely confident in those very, very fundamental situations, such as hand hygiene, such as PPE, such as cleaning and disinfecting. Because if we don't get those right, we obviously know in the work that we do, it can be catastrophic. We're thinking about CLABSIs, we're thinking about CODIs, we're thinking about SSIs, we're thinking about all of these other things, but it really gets down to the basis of the fundamental. Am I crossing a sterile field? Am I wearing the PPE in the correct order? Did I doff it in the correct order? Am I doing cross-contamination? And this is going to impact myself. And so we have to really, really drive home those pieces. And so sometimes we might have a little bit of feedback that comes back to it like, oh, I already know this stuff. That is wonderful. Then we need you to take that and run with it and teach others who might have some gaps in these areas. So that's why we also have this creation to be able to build on that. But we know because a lot of us wear multiple hats, which we just shared, a little bit of our backgrounds, that sometimes time becomes a constraint for us and we're not able to be successful in all the things we want to be successful. Because let's be honest, we're Minnesotans, we're overachievers. That's what we do. But I just want to make sure, that you have resources. So if you don't have time to really talk about those fundamentals, we got you. We have this for you and it's available for you. All right, so we have a question here. Does Project Firstline have responsibility when air quality alert is declared? Can you expand on that, Jan, just a little bit more? So like if the air quality alerts, are you what's your question a little bit more, Jan? If you want to come off mute, we can definitely kind of think about that for a second.
Well, because sometimes it talks about nursing care, nursing homes, but first responders that need to work in that kind of quality of so I was just wondering if there's a way that it's incorporated somehow for training for first responders on how to access that.
And are you thinking just training as far as first responders go when they have to wear like an SCBA? It's that breathing mechanism for firefighters. Is that what you're kind of thinking? I'm just trying to wrap my head around your question, Jan.
Yeah, because even on the news, we see that they have those masks and all of that, and it makes me wonder how much training and all of that is provided.
Sure. So for us to expand into like air quality and first responder, that is going to be some other departments that are held within the Minnesota Department of Health. Now, as far as it comes to like facilities of, like let's say hospital settings, outpatient, long-term care facilities, if there is situations there where fit testing needs to occur, or if there's annual testing or annual supplies, we definitely have an outlet with Minnesota Department of Health to be able to help navigate those facilities to get through that. Now, I know with our firefighters who also could be the first responders, they have external training with emergency medical systems. And so some of those are separated out, which does make it a little bit challenging that they have separate chapters and they have separate directors of medical care underneath them. And so it just really depends on their section that they're under. But I think to your point, if we have anything that has training on respirators, we definitely have Project Firstline training on respirators. It's under our COVID-19, and it really kind of just talks to the N95. And which is also another one of my favorite, because I'm like, I have two favorite F words. And when I say that, ears perk up and they're like, you have F words in infection prevention and control. Yes, I do. When it comes to N95s, it is going to be the filter and the fit. Those are my two F words. So hopefully you weren't thinking about something else in the adult context world, but those are my two favorite F words. So we do have some training when it comes to the PPE component of that's already available on our website. But definitely some more exploration in we can certainly have conversations with you, Jan, a little bit more after our training is complete today, and just see if there's a way we could be helpful in that nature, or be able to find some resources right now that might be available to assist in that area. I hope that helps, Jan. Maybe I just made it worse for you.
Yeah, especially right now when we think that it's over and then it's not.
Oh, right. Yes. We always have to be, part of infection prevention and control is forward thinking the possibility that, we are on that preventative side. Like how, when we think about our Ebola timeframes back in 2015, I was contact expert on a couple of those areas to have CDC First Response come out and the CDC response team. And we were one of the facilities that got first approval to be able to handle a PUI for Ebola. So, when we think about that, we were forward thinking, what is the likelihood? It's not zero risk, but what is the likelihood that we could get a patient under investigation? And because it wasn't zero risk, because we had a high population in the state of Minnesota that would travel here, and we have an international, airport, we're like, we better be prepared. We better be ready for this when this starts coming out of the door, because if it comes here before we're prepared, before we have that preventative piece, this could go wrong in a lot of different areas. And so thinking about the prevention piece is definitely something that is a goal and is a goal for Minnesota Department of Health as well. So, but yeah, Jan, if you want to email us and just give us, some more information on how we could try to be helpful to some of your extra questions, please do so. We'd love to be able to see what we can do to be beneficial and partner in some of those questions and concerns that y'all have.
I just wanted to add one comment to Karamay, to Jan's question, because I'm wondering, Jan, if you were thinking of first responders and then Project Firstline, and then the names are similar. what our role as Project Firstline is really to provide this fundamental infection prevention and control training through print resources, through interactive trainings, through live trainings, through recorded trainings, and really get at the basics and the fundamentals of infection prevention and control. This initiative is only like 3 years old. And we have been primarily working within traditional healthcare settings, like Karen mentioned, long-term care, acute care, assisted livings, intermediate care facilities. Our goal is to work also with our first responders. We haven't yet done that, but we would love to do that, to provide some of our training to them as they are dealing with infection prevention and control issues every moment of their day in all different environments. But some of those fundamental practices and policies and actions, they still apply to those frontline first responders. So we would love to, at some point in the future, get involved with first responders. So I could be way off there, Jan, but I just felt the need to share that piece.
Thank you.
You're welcome. Thank you for asking the question.
Great. Yes. Yes. And this is part of what we wanted to have out of this, is this really great conversation as well. So, we're going to take it a step further, and we're going to try to gain all of your attention at the same exact time. I want you to be able to grab your cell phone device if you are joining us outside of a virtual. So if you are in person with someone else and watching this, we want you to make sure that you're ready to go. And so here we go. Are you ready? Let's do an interactive resource called What's Wrong with This Picture? Exam Room, which comes from our May series, I Spy with My Infection Control Eyes, which is an interactive mini series that we did. Okay, let's go to the next slide. Here we go. Callie also put in a link. So I'm going to have her walk us through a little bit of the technical piece of it, and then we're going to have a training session with all of us here today. So Callie, I'll give it over to you for just an update. Thank you.
Yes, so in the chat, I've placed a link to our interactive platform, Slido. So for folks who might be joined on a mobile device, or if you have your laptop in front of you, if you grab that link and the passcode that's listed in the chat there, we'll be doing a little bit of interaction here. We often do our trainings on the WebEx platform, and Slido is integrated as part of that, but you'll have a little window that pops up while we're on Zoom today. That will give you the opportunity to vote in the polls that we'll be having, see how some other people are voting. Those responses are anonymous, and we'll also be using this to collect any feedback that you have at the end of our little mini session here today. If you run into any challenges joining that Slido poll in your other window, go ahead and put that in the chat, or if you'd rather participate in the discussion just via the chat, please feel free to do that. And we'll see how that all goes together. But I'll give it back to you, Karen.
Thank you. So I'll let everybody take just another couple of 30 seconds or so to kind of navigate that a little bit. And again, we'll be using the Slido platform. So this is going to give you a little bit of an insight of how we utilize an opportunity to gauge our participants, but then being able to do that in an anonymous platform. So if we have found that if there is just some open-ended conversations in the chat, people are a little bit more reluctant to be able to participate just because they may not be sure of the answer. So this has been a really great bridge for us to be able to still have high participation in with our interactive trainings, but then also just leveling it up with our technology, using our technology uses at our fingertips for what we have. So as we're kind of still navigating that and letting people kind of open that up, go through the passcode, typically what we do is we just greet everybody coming in. A lot of this information we've already shared with you, so I won't go over it again, but we're going to warm up our fingers with our first Slido here. So our first poll, if we have it all ready to go, is a selection if you've been with Table Talk before, or if you're a returning attendee. So that should be popping up here for us. And let me know if you are not seeing that.
Oh,
I know I am not seeing it on my side, but I also did not go into the link. So I could go into the link for the chat. Okay, and we typically have a QR code that will also help assist in that. So I think there was, okay, so we should be launching right now. Let me know what your thoughts are. I'm also going to sign in here so I can see it as well. Give me just a moment. And let me
I
join the
show
event with you.
7 people responded.
Yes. Okay. So is this your first time with PFL? You'll answer yes or no, and then hit the send button. All right. And then I'm just going to toggle back and forth. So make sure you don't close us out, but just in case, rejoin us real quickly. All right. So, oh, yes, Travis. Yes, we do use the QR code to have that link. So if people do have their devices and they're not using their device to add, come into the meeting, we absolutely have that. So air high five to you, Travis. Yes. Thank you for that extra pointer as well. I appreciate that. Okay. So we should be ready to go. I am going to switch back over. Okay. So this is how it's going to go. We did already share what our initiative is about. We already did introductions. Those are things that are just standard for us to be able to go through. And so what we're going to do now is we're going to go to the next slide. We have our agenda here, so we'll do our welcome introductions, which you've already heard from us before. What's wrong with this picture, exam room, and we're going to wrap it up with the conclusion. Okay, so let's go to the next slide. Perfect. So here we are with this training. What is wrong with this picture? So we're going to be putting on iSpy or your infection prevention control goggles. Both of those work. And we're going to be working through an outpatient exam room specifically. Okay. So this is how this is going to work. So we created this series called I Spy with My Infection Control Eye. And so we're excited to be able to just have this intimate time to be able to share this with you. And we know that infection prevention control looks very different in the settings across healthcare fields. So today, specifically, we're going to be looking at that outpatient exam room. We know that healthcare workers need to be extra aware of where these germs are found. In this particular, you saw some of that picture. And we're going to actually have a conversation of how they can spread from surfaces to people and how we can stop infections when we recognize the risk for germs to spread. So we know that a lot of our daily work is about that risk recognition. So here's how this session is going to go. We're going to pull that picture back up. We're going to have problems that we need to identify. So it's going to be your job to identify where those 4 problems are. Now there's going to be more on this picture, but we're going to identify 4. And then we're going to think about those infection control actions to prevent the spread of infection. So you're going to see Slido pop up again or have that opportunity to go to the next question here. And what we're going to do is we're going to simply have you click on the very first thing that you see with your infection prevention control goggles. What is the very first thing that you see in that picture once we reveal the picture that you understand is definitely an issue? So when we're ready, are you ready? Are you guys all ready? You ready for this? You're like, you know what? It's 7:45 at night. I don't know if I'm ready for this. Let's go ahead and go to the next slide. Reveal that picture. All right, so here it is. You're able to see that picture. What's the number one thing that your eye went immediately to understanding that this is an infection prevention and control issue? All right, so we have that picture on that Slido link again, so you're able to visualize it. So is it missing disposable hand towel dispenser? No label, or like no label at all on the receptacle for the patient gown. Blocking of event, overflowing sharps container, urine specimen without a biohazard bag, or placing supplies close to the sink. What is the number one thing that your eye went immediately to?
A sharps container.
All right. Yes. So I see that the vast majority, over 69% of you said that it was the sharps container. All right, let's go ahead and reveal if that is one of the main issues. That was like immediate, like that is exactly where all of our eyes went. So let's go ahead and select that. Let's see if it highlights. 100%, it did highlight. All right, let's click that white box and let's reveal what that has to tell us. All right, so we know when sharps containers are overfilled, this is going to be a greater risk for accidentally getting poked with a dirty needle or sharp instrument. So we know those BBFEs, we're probably all very familiar with our policies. We know that the BBFEs happen after hours on a weekend where no one else is around and it's hard to find your supervisor. So that's when it happens, right? I don't know if that happens similarly for all of you, but definitely thinking about removing and replacing that frequently used sharp container, thinking about doing that often, making sure there's a process in place before it becomes too full and having a risk associated with it. All right, great job. Let's go to the next one. We'll go back to that screen, and where else do I spy the infection control issue? And you can go back to that Slido again. And where is the next thing that you definitely see? Make sure you make your selection and hit the send button. Oh, we are all thinking alike this evening. Nice job. All right, it looks like the vast majority of us are saying that the urine specimen without the biohazard bag. Let's select that, Kelly, and see if that highlights for us. It sure did. All right, let's move on to the white box and see what we know about the action item. All right, so we know when we get those specimens from a patient, it's collected. They don't even know what they're doing with it half of the time. And sometimes those cups are, those covers are halfway on. It's not marked on. You have no idea who the specimen collection is from. All of those things that happen on a daily basis with our patients, clients, and residents. So when we know we get that specimen collected, there's obviously body fluids and germs that can easily get on the outside of the container and has the opportunity to get inside of the container. So these samples should be placed in a biohazard bag to prevent the spread of germs, cross-contamination, and or accidental spills, especially during transport. So, all right, nice job, everyone. Let's move on to the next one. Back to reset. What else do you see in this picture? And Kelly has taken out the other items that we've already discussed. Okay, so let's see what y'all are saying. Ooh, we have a split. Okay, keep going. Make sure you get in your answers. Is it missing disposable hand towel dispenser? Is it a receptacle that is not labeled for the patient gown? Is it blocking of a vent or placing supplies so close to the sink? All right, the vast majority of you are saying that it's a missing hand towel dispenser. Let's go and take a look at that picture. All right, so we actually don't have it highlighted. It's not highlighting when we click around the sink. So we can't actually see the whole entire picture. We threw in a curveball for you all. What else do you see in this photo? Go ahead and see if you can edit your response. All right, so the next one we have is placing supplies close to the sink. Let's reveal and see if that is one of the infection prevention and control issues. All right, so we have supplies next to the sink. Let's see if that highlights for us. It sure does. All right, so this is our third one. We have one more to go after this. Let's go ahead and reveal what's in the white box. All right, so tap water is clean, but it's not sterile. So we do know that. The potable water is not sterile. So places that are frequently wet with tap water, which is going to be our backsplash, it's going to be our surface area. So thinking about that water being sprayed on the areas around it from the sink. So we're thinking of that countertop, we're thinking about the handles, we're thinking about the backsplash in the wall and all of the items that are around that spray area. That can be a risk for germs to spread from the water reservoir. So that's why it's important to keep supplies away from there. But what's more important about this particular supply that's by the water reservoir? If you guys want to go ahead and put that in the chat or come off mute, what is another important piece of this? Nice job, Savannah. Yes, dripping hands getting from the soap over that supply because it's uncovered. So that's a great point. And then not to mention it's a wood. It's right next to water. What happens with wood and water? It's a perfect environment. All right, so nice job, everyone. Thank you. All right, let's move on to the last one. Let's see what our last one that we wanted to discuss with you this evening. Go ahead and make your selection in the Slido. And we're gonna get that back up here for you. We just had to make a quick adjustment. All right, so it's the receptacle's not labeled for the patient gown and or blocking vent. So which one do y'all think is the fourth concern we have in this picture? Okay, looks like a lot has been placed in here. Looks like we're almost close to a split of 50-50. All right, the vast majority of you voted that it's blocking a vent. Let's go ahead and see if that is the next highlighted area.
Oh, yeah.
It certainly is. All right, so blocking the ventilation. Let's see what that white box has to share with us. Okay, so we know that blocking a vent or blocking the ventilation system can decrease the air handling within that room or in that space. So we want to make sure that that is free, so it has that capability of being able to do its air return process. So we're thinking about that clean air. So if you see an air vent blocked, something mobile like a chair or trash can, definitely move it away from that area so the ventilation can work at its highest level that it needs to. If it's blocked by something else that's like not movable, like a cabinet, make sure that you notify the person in charge or your infection prevention control department to make sure that they're doing an assessment on that to make some changes for that ventilation to be successful. Okay, great job, everyone. We went through that top four. We can move on to the next slide. To your point, Jane, yes, yuck on wood tongue depressors that are underneath the soap dispenser and near a water reservoir. Absolutely. So y'all did a really good job with your infection prevention control eyes. So thanks for exploring this common healthcare setting with us and identifying those infection control problems, in addition to ones that we didn't necessarily have listed with all of you today. So the question to all of you is, have you ever encountered these in your workplace? You can just put a yes or a no in the chat function. And then, do we think it's common? Do we think the four things we picked out are common? Are they common practice? Are these things that you commonly see within your workspace, your work setting? And you can put a yes or a no in there. Do we see this all the time? And of course, one of the other things that we ask our attendees is, we want to give them an actionable item to do something at the end. And so we have that conversation of like, okay, if you do see this, what can we do to stop this, the situation that's happening, whether that's the specimen or the blocked ventilation or your wet surfaces, maybe, moving through that process. What does that look like? Okay, so we are still seeing all of this. We know that this is still common. We can move on to the next slide here. Okay, so we do a little bit of a conclusion here, reflection. So we know that probably grabbing your attention on this is something that you're like, oh, I already know this stuff. But we again want to just express the process that this is fundamental. We know that this is going to be a review, but we also know that it's very valuable review. And consider this information for IPC conversations you need to have with your colleagues. Maybe you're in that process where you're helping form that education and that you are going to be in charge of the education that new staff members or brand new nurses or those who are in a stage of being mentored through their education process to become a caregiver. These could be really great components for them to be able to, take a look at, have educational pieces, and we're offlifting some of that might be happening with all of you. Okay. So here's just some key takeaways from it. We just want you to make sure that you can recognize the risk for germs to spread when we choose the right infection control action to keep it from spreading. We think about the infection control process like handling sharps safely and using PPE and performing hand hygiene. Above and beyond, we want to be performing that hand hygiene. All right, so let's go on to the next slide. We do have a feedback poll that we'd love for you to fill out for us. Typically, we do give you some time to be able to take a look at that. You'll be able to go back over to that Slido piece of it. It's just a quick couple of multi-select options there. And then also, if you would love to give us some free text, it's not necessary, but definitely we value all of the feedback we get on all of our training sessions. So you were involved with one today with us. We just greatly appreciate that. So we're going to let that Slido be up there for you while we finish up our conversation here today. So let's go ahead and go to the next slide. We did have a timer there for you all to be fascinated with our ability to have our PowerPoint give us a timer. All right, so I'm going to hand it back over to Pam to talk about our Project Firstline partnership at the same time. So please feel free to continue out that Slido. but let's finish out our conversation with all of you. So Pam, it's all yours.
I'm going to give another 30 seconds because I really hope everybody fills out that feedback poll, because that information is so important to us. We want to know what it felt like to be in a training so that we can make future trainings better. So really hope you'll take the 2 minutes it takes to do that quick feedback poll, and I'll be with you in a couple seconds.
I don't have it to do.
Okay, looks like we've got 3 minutes left, so I'm going to come back on here and just wrap us up a little bit with regard to future partnerships with PFL. We can go to the next slide, Callie. And again, as we've mentioned, our goal is really to touch every frontline healthcare worker with the Project Firstline resources, because the refresher on these fundamental topics, or even maybe the new introduction to these topics for some people, is so important for our first line of defense, which is our frontline healthcare workers, our nurses, our CNAs, our treatment and medical aides, our medication aides, our PTs, our OTs, everybody who's touching our patients and the patient's environment. So again, what we want to do is partner with other organizations to extend our reach, to market the Project Firstline mission. So we do that through our training opportunities. You've just experienced one of those. Those could come in great use for you when you want to do content refreshers with your people. Maybe you're having a daily huddle before you get started in the morning. Some of our job aids are great for that. There's annual and quarterly trainings we all know that need to be done with staff. Project Firstline is great to reach for those. New employee onboarding is great. Train the trainer opportunities. You can just take the PowerPoints we've created and use those to train your staff. We would love to be part of an ongoing newsletter that you have to get to your members, or an email communication. You tell us what you would like us to put in that blurb for the newsletter, and we'll do that, or we'll create our own. We can let you know when we have new trainings coming up, when we have new resources coming up, how to reach us. We'd love to be partners with you in anything that you do to communicate with your members. Just so you know, we are active on 4 social media platforms: Facebook, Twitter, Instagram, and LinkedIn. We also are happy to do presentations like this at your monthly meetings or your bi-monthly meetings, or if you have regional meetings where we could introduce Project Firstline. As I said before, we've presented at local and national conferences, and we're happy to do that. Whatever we can do to spread the message of fundamental infection prevention and control practices. We can go to the next slide, Callie.
Thank you, Pam. And just to, before we give you our funny minute, our thank you, which is how we close out every one of our trainings, I just want to share with you what Project Firstline is currently in content creation. So hand hygiene, PPE, and cleaning and disinfecting, those ones were originally from COVID-19, and we are revamping those. So they are outside of the COVID-19 training. So very excited to get those. We're also working on an MDRO series. Right now, we decided we'd start with the hardest one. So let's start with KPC. That one we're in the middle of creating as well to give that information. And we also will be gearing some of our education to infection prevention specialists or infection preventionists, and along with leadership, to have some conversations with staff about what do you do when you see blood? What do you do when you see a rash? What happens if someone's coughing and sneezing? Things of those natures for those topics. And so those are also going to be coming up relatively quickly as well. So I will share with you our funny minute that we have. Callie, go ahead. This is how we close out every single one of ours. We have different jokes for every single training we have. So what did one bacteria say to the other bacteria? Let's find out. Let's make like an amoeba and split. So hopefully you found that pretty funny. Hopefully we have enlightened your evening with some really great content, some really great conversation. So we can go to the next slide, please.
Oh, eat those. Yeah, eat those.
Okay, here's just how to contact us, which we've also put in our chat. And go ahead and go to the next slide, please.
Oh, that's cute.
Okay, so the Scan Me one will bring you right to our website, and subscribe will bring you over to our newsletter subscription list. And so we promise we do not inundate your inboxes We just send out Gov Deliveries, that is our platform, with information that's relative to any updates we have, which includes training promotions as well. So very excited to have all of you here today and have some conversation. I will hand it back over to Pam. Thank you so much.
I think we're finished. I'm just kind of looking through the chat function. And I just noted, I just wanted to thank you for that, Savannah. And if there's anything that we can define for you right now, please go ahead and say it or put it in the chat. We're happy to do it. We really try not to do that very thing. So I appreciate so much that you said that. What Savannah said, Kelly and Karamay, is that we use some acronyms that some people were not familiar with. So we're going to make sure
I'm
that
sure
we
I
hone
probably
in
did.
on that.
Yeah, so
Oh,
I'm
gosh.
sure I probably threw out, you know, CODI and CLABSI and SSI. So we have catheter-associated urinary tract infections. We have CLABSIs, which are central line-associated blood infections. We have SSIs, which are surgical site infections. We talked about MDRO is probably another acronym I had out there, multi-drug resistant organism. And the one we're specifically working on right now is KPC, which is Klebsiella pneumoniae carbapenemase. So that is something that we'll probably hear more often than we would like to here in the state of Minnesota, but we will be working on another one for C. auris. We do have some brand new data through Minnesota Department of Health. We are still situated really well with our C. auris positive cases in Minnesota in comparison to some of our other jurisdictions, but definitely some things to think about. So sorry if I went through those acronyms too quickly and didn't explain those. We try to do our best to do both of the acronym and explaining it as well. So thank you so much. And Pam, I'll hand it back over to you.
Just we're reading all the comments in the chat. Thank you. And I just want to give kudos to Callie. She is our technology guru. She arranged all of this for you today with regard to the technology. So claps to Callie. Sites. Do I have info for less resourced sites? Yes, well, we do, Martha. And that would be what is on our website. And you also always have the opportunity to reach out to us for more tailored information. So I would send a site to our website and then have them connect directly with us.
Okay.
I think I'm going to turn it back to you, Kathy or Heidi.
All right, well, I think we're at time, but I can't thank you enough. This was such wonderful information, and to know that it's available for all of our leaders and teams, you know, it's just so rich, and I can see this being used in many different ways. So thank you again for your time, preparation, and all of the resources that you shared. I can imagine you're going to hear from some of the people on this call. So again, grateful for this time. You're going to be getting an email from MNORN with an evaluation. Please complete that and you will be getting a CEU. So thanks again, everybody.
Thanks, everyone. Have a good evening and have a good rest of the week.
Yeah, you too. Bye-bye.
Thanks.